By this time each year, many Ohioans have likely made and broken a wellness-related resolution, such as ramping up exercise or eating more fruits and vegetables. To help you stay on track and make 2023 as healthy a year as possible, I'm joined today by Dr. Rhonda Randall, Chief Medical Officer for UnitedHealthcare's commercial business. It's so good to see you again, Dr. Randall.
Thank you for having me.
Oh, absolutely. So as people try to prioritize their health this year, what would you tell them?
I think first it's important to start with having a primary care doctor. It's really important to our health. We know that people who have a primary care doctor are more likely to get those important screenings for your health, also likely to catch a chronic condition early and get a chronic condition under control, which can avoid unnecessary hospitalizations.
And what other types of preventative services or exams may be covered by insurance?
So some of these are things like cancer screenings, as well as childhood immunizations. And for people who might also be experiencing a behavioral health concern like anxiety or depression, a growing number of health plans include virtual care options to support that care. The other things to think about for our health are the non-medical things: vision, dental, hearing support. Many health plans include those services, so it's important to keep up on those checkups as well.
And what about wellness programs? How can people take advantage of those?
Yeah, it's a great question. More than 90% of employers offer access to wellness programs through their employer health coverage, but sadly, less than a quarter of us take advantage of them, and that's really unfortunate, given those programs can encourage people to pursue healthy activities, and sometimes you can earn incentives for doing that. For instance, we recently introduced UnitedHealthcare Rewards. With that, eligible members can earn up to $1,000 every year for completing various daily activities and tracking things with their smartphone or smartwatch activity trackers that look at if you're doing 5,000 to 10,000 steps a day, for example, and sharing that information. And unlike other programs with virtual coins, our program enables members to earn prepaid debit cards that can be spent how the person wants or deposited into their health savings account.
Well, that's great. I know a lot of people are making at-home fitness routines a priority. What tips would you give to someone who's trying to stay fit from home or while traveling?
Yeah, I'm glad you threw in while traveling, because we're back to traveling again. And it's important to think about things like a subscription that can offer you a digital fitness service that can put hundreds of fitness options at your fingertips. For many of our UnitedHealthcare members, they can sign up now for Apple Fitness Plus and get a yearly subscription at no additional cost as part of their health plan.
Well, now that's a good deal. So what about if people are already dealing with health issues? What can they do to access more affordable quality care?
One of the silver linings over the last few years is more and more people have learned how to access virtual healthcare services. And we see that has become really a growing area of medicine, not only for behavioral health, but think about a younger person, maybe a college-age student, and they can get their primary care services through a local provider who has virtual capabilities. Many employers are offering these services with additional virtual care offerings, and we're seeing them grow into other areas like physical therapy, dermatology, women's health, and even care for migraines.
Where can people go for more information?
They can go to uhc.com.
Dr. Randall, thanks so much for sharing this with us today.
Thank you. Be well.